women carrying pathogenic variants in the STK11 gene become the offer of surveillance, intensified surveillance for breast cancer. That means we are starting normally at the age of 25 with the investigation. It depends on the youngest age of onset of breast cancer in the families. It could be younger, maybe. And we are doing annually the MRI, which is the most effective method to investigate the breast tissue of young women, which is very dense. And these MRI will be done till the age of 70 years. And we are combining it at the age of 40 with the mammogram. It's an X-ray investigation. And biannually, we are doing the ultrasound. That means we are doing an interval sonography between the MRI investigations, and if there is a lesion, for example, in the MRI, we are doing a second look sonography. That means we are investigating the lesion the MRI detected. The problem with Peutz-Jeghers syndrome is that we have no clear data or no hard data, let me say, because we have so it is such a rare syndrome. And that's what makes it so complicated to explain what's going on with the individual risk. Comparing it with other syndromes like BRCA1 or 2, in this case, we are able to calculate an individual age-related risk for women. We can say at the age of 25, the risk to suffer from breast cancer in the next 10 years is about 5 or 7%. That means that 7 from 100 women will suffer from breast cancer, but the other 93% or 93 women will not suffer from breast cancer. So you can explain it like this. For Peutz-Jeghers, we don't have data like this, and it makes it much more complicated to talk about prophylactic or risk-reducing surgery. So for some women, the risk will be as high as for a BRCA1 or 2 mutation carrier, but we can't really say when will be the risk high enough to think about such a measure. And of course, if women are thinking over what should I do with my personal risk, and they get the offer for surveillance or risk-reducing surgery, these are two sides of the medal. You can't say the one is the right solution and the other is not. It depends on how the woman will handle her personal risk. And in most cases, that's what we learned in the last years, is that it often depends, of course, on the risk we are communicating. And as I said, in this case, it is very, you have to be very careful with numbers, because we don't have a lot of numbers. And you have to look for the family and what cases are in the family, who is suffering from which cancer. And this is what influences often the idea of a person: how could I handle my personal risk of, for example, breast cancer? Carriers have the offer to get a screening for cervical cancer. It is a yearly pap smear which will be done, and it is also for patients or women without an HPV infection. That means that with the STK11 mutation, adenocarcinoma of the cervix can occur, and therefore it is necessary to make a yearly pap smear. We don't have any effective surveillance or screening method for ovarian cancer. That is a fact. There is a lot of scientific data for that, So there is no screening method you can offer. The only method to prevent the cancer is that you remove the ovaries and the tubes to prevent ovarian cancer. Very important in the context with this is the right age to talk about the situation with the high risk. That means that the family planning is done and fulfilled, and if the ovaries will be removed before the entrance in the menopause, then the hormone replacement is very important. And if we are looking to BRCA1 and 2, we know that this kind of hormone replacement from the risk-reducing surgery to the normal entry in the menopause, it is not dangerous and it's not elevating the breast cancer risk. That's what we know, and we think that also for women with Peutz-Jeghers syndrome.